Hi, my name is Courtney Downey and I'm the manager of integrated services here at Cornerstone Care. Before we get into talking about why integrated health is so important, let me first talk to you a little bit about what integrated care looks like in our health center. So first and foremost, our main goal is to bridge the gap between physical health, mental health, and social health. Each patient that comes through our door is screened for depression and anxiety, substance use disorders, and social determinants of health. If one of those screenings is positive, our integrated care coordinators work alongside our providers to address these issues and do further screenings with our patients. Additionally, our integrated care coordinators can educate our patients on chronic conditions and assist them with meeting their goals set forth by their providers. So we talked a lot about what our integrated care team does here in our health center, but why do these things matter? So first and foremost, integrated care goes far beyond our walls here. We want to be our patients' medical home to enhance their overall quality of care. What that means is that we are in constant communication with specialists, other healthcare providers, behavioral health providers, and even home care professionals. This constant communications helps ensure that we keep our patients out of the emergency room. One of the largest benefits of integrated care is the improved access to services. Within our health centers, our providers have all been educated on treating and diagnosing a variety of mental health conditions. This means that patients who need mental health services can receive those services through our primary care providers, or they can quickly obtain counseling and psychiatry referrals through our office. Additionally, on the reverse side of this, our behavioral health patients who only see our behavioral health department can quickly receive referrals into our primary care services should they need them. One of the questions that we commonly get asked is, why does my doctor care about my housing status or my education or employment status? Research suggests that 70% of primary care visits stem from psychosocial factors. This is why we screen our patients for social determinants of health. These are the conditions in which people are born, grow, work, and age that affect a wide range of health and quality of life outcomes. One study suggests that clinical care impacts only 20% of county-level variation in health outcomes. Social determinants of health affects as much as 50% of health outcomes. Our integrated care coordinators can assist our patients in accessing local resources to help combat the effects of social determinants of health and work with them to achieve health literacy to better understand their risk factors. We also know that chronic health conditions such as diabetes, substance abuse, asthma, obesity, and cardiovascular disease requires behavioral health interventions for best outcomes. Our integrated care coordinators can meet one-on-one with our patients to identify barriers to obtaining these goals related to these conditions. I hope with this video we have helped you learn a little bit more about why integrated care is so important to us. And know that Cornerstone Care cares about all of you, not just your physical health. If you have any questions regarding our services, please feel free to reach out to one of our health centers for more information.